out, and
Go ahead. Sorry, I forgot to hit the record button.
we got his medications sorted out. He got his Social Security disability approved with money coming in. We got all his finances squared away.
Goodness.
We managed to find a place for his very decrepit trailer to sit in the back driveway of a friend of ours over the other side of Chambers. And we were going to be meeting with him to start the process of finding supportive housing for him in the county, and his prospects were pretty good. We had been working with the one of the social workers at River Bend, because he'd been in the hospital a couple of times over the last couple of months, and there were definitely avenues for him. And the day after Christmas, he was going to be doing two things. He was going to come over to our house with all his paperwork, and we were going to get everything squared away for moving the next stage forward to get him into proper housing. He had about 15% of his heart function left, so he was pretty poor shape, even though he was like 7 or 8 years younger than me. But he had lived a very different life from me. He'd been in jail a couple of times. Anyway, I went to pick him up the day after Christmas. He was also coming over to our place to open the gifts that we had wrapped for him under our tree. I got to his place. He was a little bit delayed coming out of his trailer to get in the car, and was a bit frazzled because he'd had an unexpected visit from a friend earlier that morning. He came out, and then he cried out before coming out of the gate from the driveway. And our friend who lives at the house said, "Call 911." And called 911. While we were waiting for 911, I went through the gate and was holding his hand as he died. And it affected me very strongly. It was my first encounter with death, other than cats and dogs. And I realized for the next, really since then, that it wasn't just grieving that I was going through. I was also going through an exposure to the trauma of being unhoused in anywhere, particularly Eugene, where there's such a contrast between the haves and the have-nots. And I had heard about the trauma of being unhoused, and I had heard about the trauma of being exposed to that. And I wanted to share that because those of us in this process, Doriandra and others, who are like the front line for this initiative that we have from the council, are exposed to people with challenging life situations, challenging housing situations. And many of these people are probably in a similar traumatic state. And that is something that does transmit to those around. It's not something that people keep to themselves, because it's impossible to keep to themselves. So what I was wanting to do is put this on the agenda and ask us all to be totally aware of it. And as we are interacting with each other, to be aware that any one of us, particularly those on the front line of what we're doing, particularly being aware that people may be experiencing this vicarious trauma, or this transmitted proximity trauma. And so it's really just a plea that we be aware of this and treat each other as gently as we possibly can, because we're doing incredibly good work. We don't have the all the skills that people like Mother Teresa has or had, or Francis of Assisi, but we're mere mortals. So keep that in mind, and please let's keep the well-being of each other in our hearts as we're going through this. So I apologize for taking people's time for this, but I felt it was important because it is a very important topic in any community.
Thank you, Stephen. Yes, I really appreciate it. In the medical community, we refer to that as trauma-informed care. And it's important that care is taken of the caregivers and of those others who are working in the community to provide services, because as you say, that trauma does transmit. So by all means, thank you for bringing that up. I'm wondering what you and others might like to do about that. Do you think it might be useful to see if we could get somebody to come to one of our meetings to talk about methods that we could specifically do to help cope with the trauma that we undoubtedly and inevitably encounter in doing the sort of work that we do?
I am planning to attend an event at what is the place that used to be a church run by Eli?
Oh,
Alluvium.
Alluvium. Yeah, I'm going to
thank you, Jen.
senior brain. There we go. I'm going to an event at Alluvium. It's either this Sunday or the following Sunday about basically climate trauma and reading the bio of the person leading that process. I will make sure I speak with that person and ask if he has had any experience of working with caregivers in the unhoused community. That may be a lead to follow up. But I don't have any other connections to who know their way around this stuff. And but I will follow up with him at that event at Alluvium.
Thank you, Stephen. I think that would be an excellent idea. Anyone else have any thoughts on these issues? All right. I'm going to move on to the next batch of things, but thank you, Stephen. That was very
Thank you,
important
Stephen.
for you to bring up.
Thank you very much. That was great.
All right. So on other important issues, talking about trying to continue our attempts to make sure that people get to stay in their places by providing the funding through the granting mechanism that we've been able to use. There have been some discussions about, excuse me, about how often the checks should be cut. And although there had been a lot of talk about it, there hasn't been a specific decision about it. And so it's something which it would probably be best if we came to a definite understanding with everybody involved as to how often and when that was going to happen. We were talking about doing it twice a month. There's some discussion about doing it once a month. Do people have any particular feelings about it one way or the other?
So
Don't jump up all at once.
oh.
Delinia, you raised your hand. There you go. I saw it. That's good.
As
What are you
far
thinking?
as I'm thinking once a month, and that's because we have to also
Mhm.
consider Drea's time. And again, she's only being paid
Sure.
for 3 hours a week to do our work. So one of the things
Right.
that she's taken on, that's more considered like a payroll, which would be an additional fee normally. So
Mhm.
I would say once a month would be the best way that we can handle it possibly. But I haven't talked to her.
Any other
about
opinions
that.
on this? Okay, Jen?
Yes, I'm wondering, when is there a due date that has to be addressed when it comes to answering these questions, like with the treasurer as well, that needs to be inputted? Maybe that would help to have a due by date that we need the inputs in so that we can meet the due date to be, up to par.
Sure.
Is there a due date? I have, it's a question.
That's a good question. I don't specifically know. Delaney, yeah, do you know if we were to do it just once a month? Do you know? You don't. Okay. Do we know who would be best? Jen was suggesting maybe we talk to the treasurer. Who would be the right person to talk to about it?
I would say the treasurer and the bookkeeper.
And the
I
bookkeeper.
know,
Okay.
yeah,
No,
I know that she's,
I have a slightly different question, which is is this the only way we can actually do it? My concern is that if you only have one person who can actually do this function, and it doesn't really matter what the function is, if you have only one person who can do that function, then to some extent you're setting yourself up to fail,
well,
because
technically
inevitably
there should be
there-
two
there's
people
gonna- there's-
signing.
yeah.
Oh,
Well, no, what I'm saying is, even with, I'm just thinking, I don't want to spend too much time on this. We've got too many other things to do. But okay, I'm a science nerd. I'm a space nerd, and so one of the things that I always refer back to is NASA always has 3 computers to back each other up, so that if something goes wrong, there's always one that works. And so I look at that as a model of how to do a lot of things. There should always be a backup plan in case the original one doesn't work, right? And having one person or whatever just to do things, it seems like that's could lead to problems that otherwise wouldn't have to be there. And that's all I'm going to say about it. I don't want to go into it right now because it could take too long, but that's my thoughts. Jen, I saw your hand up first, and then Stephen will get to you. Jen.
I don't want to eat up your time that you're talking about, but I'm a little confused on who's responsible to get X amount of information to X person. And that's what I'm not clear about. But I don't want to take up time if you're saying we have too many other things. But that's just seems to be a problem that's reoccurring.
I respect that. So I will make a point of, so our treasurer, who's our treasurer?
Andrew.
Andrew, right. So I will contact Andrew and get his input as to when checks can be done. Andrea is the bookkeeper, right? So it's those 2 people that are going to be determining some of this in terms of what's going to work within their purview, right? So in terms of who are the people, those are the people, and I'll track that down and get that information out to everybody. Okay.
And
Does that
then
answer your
I
question?
I would be the last step in that.
Sure.
Where once
Okay.
all the checks are
Good.
ready, then I would come and sign. But it's
Right.
not just the check for the
Okay.
people who are, it's all
Right.
expenses because there's, that goes with the grant needs to be. So
Sure, of course.
I can just go
Okay.
sign checks and come back.
Sure. That's great. Okay, so we got Andrew, Andrea, and Delenia. Got it. And I saw your hand too, Doriandra, but Stephen was up first, so I'm gonna call him first.
Well,
Stephen, hi.
I'd like
So you had
Doriandra
your hand up.
to go first because it maybe Doriandra may have something I was going to say.
Ah, okay. All right. Hey, Doriandra,
Move to
your
the
turn.
top. Okay.
Hey.
First off, the people that I'm working with that are applying to the Housing as Healthcare program have all kinds of varying dates of crisis. Some have 3-day eviction notices, some have 1 day, some have 30-day. So it's really hard from where I'm sitting to determine a date that everything has to be in by. But I am consumed with gathering the data, talking to the people, accessing income eligibility,
Right.
all the multi-layered steps. So all I need from the board, Andrea, is simply a cutoff date that would allow that batch of people to get the help they need before they're evicted. So best case scenario
Mhm.
for me would be that we go on a monthly
Uh-huh.
basis, which is sad because it doesn't, a lot of people will fall through the cracks. But through navigating with landlords, I've got them to say, okay, we're going to put the brakes on here because the WCC is promising to give us this money by February 1st. So for me, the first should be the absolute cutoff date that people are getting checks every month. And I just need a date for when to stop my work and know that somebody's going to receive the data and they're going to be happy with the way I've sent the data, which is I'm inputting it every letter that I get, when I get it, it's all in the spreadsheet. And so like I need to know that date that somebody says, okay, stop taking intake for this batch for
Right.
this month. And without that, it's totally unfair to the people that I keep talking to and saying like, it's okay, help's coming, we got
Sure.
this. So that's my big hope here is that we can establish this today. And those goalposts keep moving radically. People are sick, they're out of town, the taxes are due. You know,
Sure.
there's always stuff that's going to come
Sure.
up.
Sure.
So from what I've understood, Delinea is saying that for Drea, it's very hard at the top of the month, at the very top, because she's got a lot of payroll and other things for all the other businesses that she works for. So that sounds to me like we should be shooting for somewhere in the middle of the month, that or mid, you know. So that's why I was shooting for the 27th, because it gives a little bit of time for her to catch up. And then it's just like a couple that usually gives us a week that she could cut them, get them to the Linea, and I could get them in the mail. So I'm perplexed and saddened that it's been so incredibly hard, but that's definitely what I need to continue serving the people that are applying to our
Sure.
program.
I mean, everybody needs to know what's going on, what has to happen, and when it has to happen in order to make it function. Sure, you bet. That makes perfectly good sense. Delaney,
Do you want,
yes.
Stephen, did she answer your question or did you want to ask your question first?
Oh yeah, that's right. Right.
Yeah.
Stephen, now that Leandra has talked, do you have something you would
I
like to
do,
say?
and what Doriandra says makes what I was going to say even more relevant. Reading correspondence that's been copied to me, it appears that the state is telling us we're not handing out money as quickly as they hoped we would. Every time somebody falls through the crack, that's another check that no longer needs to be sent. And we have a budget we have a line item in our budget for the administrative support for this program for Doriandra. Is there any line item that can be squeezed in as a budget adjustment to cover accounting support for this program? So in other words, can this program pay for additional time for Drea if she has that flexibility in her weekly schedule? So this appears to be this seems to be a choke point in our process that's having a ripple effect, and it's making it more difficult for us to hand out money as fast as the state wants us to. So can we deal with this choke point by putting some money in that direction? If not for this grant, then the next one.
I don't know, but it's an interesting question. Doriandra, you have some thoughts in the area?
Yeah, we're definitely pulling Drea's salary from this grant, and the amount of applicants that I'm receiving seem huge, but after all the multiple steps that have to go through to get grant compliance on the individuals, we're only averaging about 5 to 7 that are even real. The rest are fraud or have other multiple services going on. So we're only talking about 5 to 6 to maybe 10 checks a month,
Okay.
which I don't know what that means for Drea, but just 2 points that it's I can't anticipate that it's going to get much further than that. And to kind of veer off. Go ahead, Delinea.
Wait, just a second. First, I wanted to say, since you mentioned all the fraud and stuff, well done catching that,
Yeah.
because that's going to look real good. And I'm sorry we're not being able to get the money out as fast as we'd like, but that's excellent that you were able to do that. Okay, having said that, Delinea.
So again, for the bookkeeper, it's not just those checks. It's everything that has to do with those grants has to be put on that spreadsheet. So she can do all of the bookkeeping for it, if that makes sense. So we have to not just figure out like what day of the month are we going to do that, but when do, other circumstances as far as any other checks that need to be written out comes also. Does that make sense? Go ahead.
Sure.
Oh,
Give
Two
me
things.
just
Yeah.
a second here. Jen has something to say, but I have a question, which is one of other things we're going to be talking about is in fact spreadsheets. So perhaps we need to get on to that to be able to answer some of these other questions. But Jen, you had your hand up.
So I'm going back to you, Anand.
Hi.
Are you going to then communicate with Andrea, just so you can come up?
Yes.
What will work with all the spreadsheets and everything that needs to be done at one time?
I will communicate with them and ask them what their input is. Yes. I will.
Thank you.
I
Lovely.
specifically said I will do that.
Okay. Lovely.
And Delinea too, and Andrew. I'm going to talk with everybody. What good will it do? I don't know, but I'm going to do my best. I'm a fairly friendly person, and people don't bite me too much, so usually it works out okay.
Just a quick little thing.
Sure. Yeah.
Drea might not have your correct email, Anand, because she said that she's been reaching out to you and Andrew, and it's been a little silent.
I haven't seen anything.
That's what I'm thinking. She
Okay,
might not have your right email.
Okay, very good. I'll look into that. Durandra, I saw you had your hand up there.
Yeah, well, it's okay. We'll wait. If you want to keep going.
Okay. So I'm gonna move on from the check because we all read once a month. Okay, that was the question. We had an agreement on that, so we're good. So the spreadsheets, different types of spreadsheets, and the question is the pending checks needed spreadsheet going to work out best for everybody, or what? Yeah, I know. Unless you're actually involved, it doesn't really make a lot of sense. I got it, Derek. I got it. Don't worry about it. It's okay. I mean, unless I pulled one up, you wouldn't really make a lot of sense. I'm sorry. Durandra, did you raise your hand first, or was it Stephen?
I think I did.
Okay, good. You did.
It should just be really simple. It's back at the 2021, I created a spreadsheet. Ian and I made a spreadsheet that was like super simple. It just has who needs to get paid, what they're doing in terms of, are they a contractor, are they a recipient, are they Instaprint, whatever, the amount, and then where that money should be pulled from, which grant, because at the time we had 3. And so that's a good one. It's very simple. It's easy. We've all of it, Drea, Delinea, Andrew, we're all used to it. I think the chaos started because Drea and I, in a meeting, we were working from one that had a really careful budget, the budget that I worked out for this program. So it was my understanding that she wanted to receive all that data in there, but it turned out to just be too much data. And so then I pivoted over to the simpler one that we were all accustomed to using for all the other grants. Mm-hmm. And in my opinion, that's the one that we should use. And I will do the careful tracking and detailed work on a separate thing so that nobody's confused moving forward.
So you're saying you're trying to simplify it to make it less confusing?
to just go back to the original way that all pending checks were. It was called the pending check needed spreadsheet. And I'm happy to show them to everybody if you'd like, but
You have
we
one
can
as an
just vote.
example that you could put on you could show
Sure.
to us right now? Okay,
Sure.
give me just a second. Delinea, yes.
Okay.
I really think that needs to be discussed with Drea. Because again,
Sure.
with those spreadsheets, it was something that was created, but the information that we were getting back then was still not sufficient information. And that's why Andrew is doing the grant cleanup, or I'm not even sure if he finished that, to be honest with you. So one of the things was it really needs to be coordinated what Drea needs, because it is a 3-hour a week
Sure.
kind of thing. And like I said,
Okay.
she
Sure.
reached out a couple
We'll
of
get to it.
times. She has reached out a couple of times to Andrew, and then I believe once to you, Anand, but not sure where everything went.
I will make sure I get to her one way or the other
Gotcha.
to try to help, sort some of this out. Obviously, we want things, you need sufficient information, but you also need not too much information. And trying to find that balance can be a little bit tricky. And sometimes people's balance points aren't all in the same place. And so I understand that can be difficult, but it's not something which can't be worked out. So I'm not that worried about it. As long as we've got people on top of it, it should be okay. Doriandra, and Jen will get to you.
I just want to say that, I'm only at 20 hours too and dealing with dozens of caseloads of families. So again, just tell me where you want the data and I'll put it there, because I'm not willing to be putting it back and forth and arguing and going days and days with confusion. I just need a clear understanding. And Drea had given me, in a meeting, her and I, we worked out this complicated budget one. It was my understanding that she wanted all the info there, and that's where we started. But then that proved to be too confusing. So we pivoted back to the easy one. So whoever wants to tell me where it goes once, I'll put it there.
Very good. Okay. Jen, what's up?
Okay, so I guess what I'm asking is, am I hearing that somehow you are going to make sure that both the spreadsheets that Juliana was suggesting and that Drea needs are going to commingle, are going to connect, are going to be correct, so that we can resolve this problem that's going on? And you're going to take care of that or not?
I'm not going to do it exactly the way you're saying it, but I will get a hold of Drea and I will get a hold of Andrew, and I will do what I can to kind of smooth things over one way or the other. So I'm just trying to take everybody's things into consideration, and I will look into it. Okay.
Thank you.
If it can be done, I will see to it that it gets done sometime in the next just couple of days. I will put a lot of effort into it. Okay.
Yes, thank you.
Well, would you also
Delinea.
just add to the end of that the date that I need to sign checks?
Sure.
Like when you check in with
Sure.
Drea. Thank you.
You bet. You bet.
Mm.
I will absolutely do that. Give me just a second while I write some notes to myself. Excellent. Okay. So far, so good. I just wanted to tell you that Thea contacted me. I wasn't able to get to the phone fast enough because my coffee hadn't kicked in. But on the answering machine, Thea contacted me and said she was quite willing to help you, Doriandra, with anything that you needed. Although something happened, somebody was in an accident. There was some sort of traffic thing. So she's got some stuff going on right now. But she is very interested in being assistance to you when she can. I thought you would like to know. Okay. So, results of the OHA meeting and other stuff like a potential further funding, new public health equity grant, all that sort of stuff. Can you tell us about that, please?
Sure. I met today with our community coordinator for the specific ORAP grant. And, you know, the grant was red flag for not spending
Right.
enough. But when I showed her the timeline of everything that had happened with the WCC in terms of all the clinics and then the overlapping CDC grant, the murals project, it made perfect sense to them.
Mhm.
And they were fine with
Yeah.
that. And also pointed out that the red flagging probably was not because of this portion of our work, but because there's still an outstanding Q7 expenditure report that has not been done. And so to them, that signifies that we've stopped spending anything. So to that point, I am volunteering to do the expenditure reports moving forward, but I'm not getting information that I need regarding Drea's salary. I had the Q8 totally done because basically the only thing we're spending on this grant are the recipients that we're keeping in houses, my salary and Drea's salary. So the OHA really needs the Q7 report to be done. And if people don't want me to do the Q8, I'm fine. It's a volunteer thing because I'm already over hours trying to deal with the folks. So somebody needs to get those done quickly, or, you know, that was really the real onus of why they red flagged us. So that's important to note. But otherwise,
No, go ahead.
Delinea or
No, Durandra, go ahead and
okay. Otherwise, I had sent them all of the program, and I've been relating to this woman, you know, asking her millions of questions about grant compliance and everything from the very onset of when I started the program, in terms of researching it, and then we all agreed on it, and then we launched it. So she's really excited about it and said that it's doing a great job from the numbers I could give to them, which I want to share with you all too. Since December, the WCC has been able to keep 16 families in their homes.
Yay! That's so cool.
Yeah, of those 16, 2 were in transition and needed the funds to get into new security deposits. So 2 of them went there. And then the other 14, I navigated through all the bumps so that we could get their landlords calmed down, paid off, and ensure that the tenants would stay in those units. So that's really a huge success. And those 16 families have cost thus far $46,295.50. So when we look at that in terms of a period ranging from December to February, that's really good. It's means that we can accelerate the program if we can get the checks and things like on a better, easier timeline. Gives me more time to get more people in the next 3-month quarter, which is going to be March, April, May, and then the last month of June. So my goals as program manager of this is to escalate and gather more and more people so that, because now we just need to spend down another 200,000, and that could be another serious block of people that are kept in their homes. So that's really good news. And I think that's we've all done a great job to get that much spent so far and that many people safe.
That's great. That's really, really encouraging. And I'm so happy, and thank you so much for everything you've done to help people out with that. That's great. Delinea, you did actually have something else that you weren't wanting to say.
I think it's more of a question-ish.
Sure.
About the last report. Because to my understanding, Doriander, that Andrew was taking care of the last portion of it. But to be honest with you, I've heard no hide or hair of him. So I guess my question is, did they at all ask, was it, you're talking about the portion of it that was the last one with the vaccine clinic? Is that correct? That's the
Correct,
report
yeah.
they're missing?
Yeah. Yeah, when we think about the housing grant, the COVID vaccination, and the public community outreach, all those things, as you know, they're just all under one umbrella of a grant. Yeah. And so I was asked today, well, have we done the closing process on the subsets of the grant that we finished back in June when, we had our last COVID vaccination clinic? And I don't know. I don't know where Andrew is with it. I don't have access to the books. I don't know anything how to help that. I know, Delinia, you and I think we did activity or expenditure 6 to try to just fix the errors, but then we're really stalled at 7. And I, having taken us through the CDC grant from start to finish, every aspect, whether it was the expenditure, the activity, the writing, the bios, everything related to it, I can take this on and I can do the expenditure and the activity reports for the housing grant. And that's what I was trying to at least do, like get Q8, quarter 8 done, because again, there's nothing in it that's complicated. It's just Drea and I salaries, and then the families that we were able to serve in the October through December quarter, which is only six families. So to me, it seemed really simple, but I couldn't get just the number for Drea's salary. Andrew didn't send the report, so I just figured maybe that meant he was uncertain about me taking the ball and running forward if Q7 was still, in peril, or, if he was still trying to work on it. So when I asked the grant officer today, if, I told her that was my hope, was that even if we could just get current with Q8 about our expenditures from October to December, if there's problems there, they can come back and ask us. And she said, yeah, get Q8 done. But I totally respect Andrew's concern about trying to make sure that 7 is right before we go to 8. So I just don't know. I haven't had an answer from him about that.
Okay, so I feel a little responsible because Dre has been trying to get a hold of me and hasn't been able to. So I'm all the more reason for me to follow up on this, which I will do, and see if I can. Yeah. In any case, I will do what I can to facilitate communication. So the last thing was the new public health equity grant, and you, Doriander, you wanted to say something about that?
Sure. And 2 quick things. When we talk about, I think we were all really hopeful that there would be so much more funding coming into the housing grant, and potentially we could keep Whitaker Community Council funded moving forward. Today, I learned a really strange thing that I did not understand until now. The funds that we're spending down now to keep families in houses is actually part of the Oregon Housing Community Services, which at the time they were funded through the federal sources. They didn't have the same infrastructure with community engagement liaisons, grant officers, all those details. So that's why the OHA has been managing those funds. So when we think about our success with OHA, it's valid, but our grant was with OHA, not with OH Community Services, if that makes sense. So it is a big question mark whether this portion of our work will be further funded moving forward, because there's that separation of institutions. Right. And the woman that her name is Dolly. She's a stunning person in leadership in OHA who has been managing the whole umbrella of these grants, is always actively seeking to, empower our community-based organizations and may find more funding. But it is a big pause, like it's a big question. And for me personally, it's good to really feel, the urgency to really spend the money that we do have, and with the expectation that there may not be more to save more folks down the road. So it really it behooves us as an organization to get as
Yep,
tight as we
yep.
can with our plan, our counting, and just get this out. So, because we will lose everything we have left by June, at the end of June of 2023 if we don't
Yeah.
spend. So first point. Then second point, the whole reason that secondary grant, just a quick background
Sure.
on that. Back in 2021, Ian and I worked on a grant together that we submitted for the Public Health Modernization Grant, which we did not receive as an organization, all of us.
Mhm.
But what happened was that they came back around and said there was a little bit of funding. And so I took that information and asked OHA and the Public Health Modernization Grant officers if we could braid the current Housing as Healthcare program with that $25,000, even though it had nothing to do with what it was supposed to be part of. But they said yes, because they were excited that this was a program we were going to launch. And so I think as a board, everybody's probably very much agreeing with me that we want to take that 25,000 and use it to pay Drea and I our
Sure.
salaries. And then we have 250 untouched, essentially. I mean, we're touching it, but we'll have 25,000 more to give to put into housing for people in crisis.
Okay.
I hope that makes sense.
So the health equity grant.
Mhm.
So how are we applying for that?
That was the one that I think on the day that it was due, Thea was able to get to Delinia. Delinia signed off, and then it was sent back.
Oh yeah, yeah. That's right.
That
That's
was that whole thing. And so I don't know now what is happening with it. Again, I don't see money coming in for the grants. I have no access to any of this. So, but I believe that it is in the pipeline, and I think if I remember correctly, Delina, you had already sent them some forms. It just needed that last signature. So this is a real confusion to between Drea and I, because I can't see when we're getting funded, and often she would say, Doriander, what's the 7,000? And I would, if I had better understanding of the grant, I can say, oh, that's the last payment for the CDC type of thing. So I'm not sure if it's come in, and I don't know what it's going to look like or how she'll even know. It's part of the overall complexity of grants. They're as clear as mud. So
all right.
And it kind of goes
Well,
back
that's all
to,
very interesting.
yeah, it kind of goes back to Andrew pulling the reports from QuickBooks, because I also don't have access to the QuickBooks or the
Right.
reports or anything. I just sign them away.
Right.
Yeah.
Yep.
And then I'm gonna put I
How-
don't know if this
how
is
will-
gonna, oh, I just wanted to let Doriandra
No,
know. I'm gonna put her salary in the chat for you. I don't know if that helps. I know that she did tell me we missed the payment. But I
yikes.
guess we'll need to verify. It was a older payment. So maybe from the other grant. So we can,
yeah, that has to be super tight. Like we just need from October, November, and December. Yeah, it's so frustrating because all the confusion of the past, I feel like we just had this kind of like clear road open now, but it's still messy, I guess, with Q7 and
Okay. I have a kind of a general feel for things, I think. I will contact Drea and Andrew and kind of get a little bit of a feel for all of that. I'm thinking that it might be a really good idea if Drea and Andrew and Dorianda and Delinia and I all kind of like got together and worked on, honestly, I think it'd be nice if we could actually meet in person. I don't know, New Day Bakery or something. They have some nice tables. You know, and with some actual real paperwork, and you know, all of us taking a look at stuff and going like, this works for me and that doesn't work for me. You know, just the electronic stuff is all very well and good, but I know for myself, I need hard copy because there's only so much I can actually do online. Anyway, I'm gonna chat with them, and we'll see if there's something that we can set up so we can all kind of be in real life. Oh my God, what a concept. Okay. Thank you, everybody. We're getting towards the end here. Any last moments? I want to again thank Stephen for bringing up the trauma-informed issue. I think that's really, really critical. I really appreciate you bringing it up, and I think we need to look into it more. If there's maybe something we could do during a meeting at some point, have some expert come in and kind of walk us through a little exercise or something that might help us kind of understand and deal with our trauma somewhat. Because inevitably, as you said, Stephen, we are going to encounter these things, and it's gonna transmit. And it would be really nice if we could find some way to kind of like, you know, air that out. So thank you, everybody. I'm going to close things out. And Delinia, I will definitely come to your next one here right afterwards, but I think I better stop and have some dinner.
Okay.
Okay.
I'm gonna
Thank
stop.
you, everybody. I think we've all done a great job. I know we didn't solve the world's problems, but we solved a couple, and that was good enough for me.
Thank you, Don.
I'll take you all.